All right. Good evening, everyone, and thank you so much for joining us tonight. On behalf of the Center at the Sierra Health Foundation, the Black Child Legacy Campaign, the Trauma Informed Wellness Program, Be Mom Aware, and the Sacramento Mental Health Collaborative. We are very excited to present mental wellness during pregnancy to discuss the impact and the importance of maternal mental health. I did want to start off with a few housekeeping rules just to make sure our program flows on time for tonight. This meeting will be live streamed on Facebook, so please feel free to share this link with your families and partners and be able to redistribute as time allows. We also will be recording the call and will send all of our participants today the recording to have for their reference. For today, we know that we will have some really great information and a lot of questions. And so we kindly ask that you use the chat box, the Q&A box at the bottom of your screen to ask your questions, and we will have times throughout the program to be able to answer those. We please ask that you don't use the chat box for your questions, just to make sure that all of our audience get a chance to address any questions they may have for tonight. Aside from this, we welcome you, and I will now turn it over to our team to get us started for this evening.
Welcome, everyone. We are so grateful to have you here with us this evening, celebrating and encouraging mental wellness during pregnancy. My name is Shelly Dyer, and I'm the Senior Program Officer with the Black Child Legacy Campaign, Sierra Health Foundation, and the Center. With the Black Child Legacy Campaign, we focus on reducing African-American child deaths across 4 focus areas, but we can't talk about creating a world and environment for children to thrive without creating a world and environment for Black mothers and Black birthing people to thrive. So we're really excited to bring this program to you all, and we really look forward to continuing to be in conversation and in action to make sure that everyone has really positive birth experiences and positive birth outcomes. I'll pass it over to our partners at the Sacramento Maternal Mental Health Collaborative.
Good evening, everybody. My name is Brenna Rezan. I am one of the leaders of the Sacramento Maternal Mental Health Collaborative. And Sacramento Maternal Mental Health Collaborative aims to increase knowledge about maternal mental health conditions and resources for both parents and healthcare providers, as well as policymakers, community organizations, and maternal and child well-being and other stakeholders. We systematically prioritize the physical and mental well-being of the mother-baby dyad with cultural sensitivity so that our families, communities, and economy can thrive. And I will turn it over back to Shelly.
Thank you. I think that Jessica, are you with us?
Yes, my name is Jessica, and I am one of the co-chairs of the Sacramento Maternal Mental Health Collaborative, along with Brenna, and I'm just excited to be here.
Wonderful. Thank you all so much for that warm welcome. And I would now like to pass it over to Amaya Noguera, Program Officer for the Trauma Informed Wellness Program with the Center at Sierra Health Foundation. She will be providing us with a wonderful grounding and libation to gear us for today.
Thank you, and good evening, everyone. As Monica mentioned, my name is Amaya Noguera, and I'm a program officer with the Center at Sierra Health Foundation. I'm honored to welcome you all this evening to engage in a very important conversation which centers Black pregnant mothers and birthing people, and specifically focusing on their mental health. But before we begin that agenda, I think it's really important for us to kind of pause. I would like to ask all of you to please try to plant yourselves in a way that feels comfortable for you. I'm going to ask everyone to please take a breath with me. And to visualize yourself in the roots of your body, Try to plant yourself here and please release the distractions. While I know it may be a lot to ask, I would love for you all to absorb as much as you can today so that we can take what we've learned and pour that into all the people and places and spaces that we will be, and that we can help to continue to protect and properly care for some of our most beloved and vulnerable populations, our Black mamas. As a mother myself, I'm here with my daughter. I also know what it's like to lose a mother. And so I know from experience how difficult these conversations can be and how necessary and very delicate we need to conduct them. So we're going to start this conversation by pouring libation to honor our ancestors and all of those who are no longer with us. We do so as a form of ritual to pay homage and acknowledge that we are here today because of them. This is a participatory exercise though, so I will need the help of all of you. And first, I would like to introduce my eldest daughter, Ashe, who's going to help me pour the libation. So the way libation works is we will say the names of those people who have transitioned and are no longer with us, and we will say the word Ashe, which literally translates to, and so it is. We'll do so in 3 phases though. The first, to acknowledge those that have passed away or transitioned. The second, we will pour into the plant for those people who could not be here tonight, whose voices will not be heard tonight, but are the very reason for having these conversations. And the third, and lastly, we will pour for those who are still coming, that will continue this work when they arrive, and that we want to make this world a better place for them to inherit. So I'm going to ask you all to participate in sharing some names of those who have transitioned or are no longer here.
Mama Charlotte Louise Dyer.
Ashe.
Ashe.
Patricia Batuone. Ashe.
Ashe.
Grandmother Diane Siebold.
Ashe. This could be someone in your family. This could be a hero or shiro. This could be anyone in your life that dried your tears, nurtured you, or enacted in any way the way a mother would. So we want to honor them.
My grandmother, Annie B.
Ashe.
Ashe.
My grandmother, Mary Goff.
Ashe.
Ashe.
And for all of you who are unable to speak, we pour for you as well. For the voices that are not here on this call, that are not able to participate, that are struggling, we pour for you. Ashe. And last, we pour for our future, for all of those who are yet to come, that we do everything in our power today and every day forward to make this world a world that will welcome them and embrace them with open arms. We pour for them, Ashe. And I'm going to ask you all to join me in unison. We will say it 3 times, Ashe, to close out this libation. Ashe, Ashe, Ashe. So while today, tonight, this evening, we are centering Black birthing people, we know that these conversations need to be shared and become common knowledge. We can't expect birthing people to carry the weight of learning about our wellness and holding our wellness as our own. We must have a collective effort to support this. And with that, I will pass it on to my partners for continuing on with the agenda. Thank you.
Thank you so much, Amaya. That was beautiful. So I would now like to move us on to the next section of this evening's webinar. I would like to pass it over to Brenna Rizan from Mom Be Aware.
Yeah, so we have a poll that we would love for you to fill out, and I think Monica's going to launch it here in a second. but just to get your initial reactions on what maternal mental health means to you in your world.
Wonderful. Thank you so much, Brenna. So the poll has now been launched, and we kindly ask that you take a moment to select the best answer, and then we will go over as a group the poll results. And we're at about 44%. So if you all can type in your responses, we have just a few more to add in.
And I do want to add in, if you are watching this on Facebook later on, you can visit our website at bemomaware.com to fill out this survey. So please just send us an email there or contact us at bemomaware.com.
Great. So I have us at about 1 minute. So I will go ahead and end our poll and share our poll results.
I am so glad to see these results because maternal mental health is the most common complication to pregnancy. And so all of you here, know that and see that. And if you, chose not to, do the poll, that's okay too. But, just knowing that maternal mental health is a common thing, is something that touches at least 1 in 5 women's lives is so important. And it can happen anytime from conception through the first year postpartum. And for some of us, it goes even beyond that first year postpartum. And I know we're going to hear from Jessica soon, who will talk about her own experience with maternal mental health. And so I'm glad that we're all centered in the same knowledge about maternal mental health being a common complication.
Wonderful. Thank you all for providing your insight. And I will now transition this over to Jessica.
Hello, everyone. My name is Jessica Walker. I am the co-founder of Be Mom Aware. I am also a co-collaborator and co-chair of the Sacramento Maternal Mental Health Collaborative, an advocate as well. So to share my story just very briefly, I grew up in the Bay Area, and in the Bay Area, during the time when I grew up, there wasn't much talk about depression or really any mental health, let alone maternal mental health. So as I matured and I started to have children, I think about the 3rd child, I am a mom of 6 amazing human beings. So on the 3rd child, I noticed that there was something a bit different. There was something that was going on. And I wasn't able to quite put my finger on it. And I think what we understand now in our community around like stigma and self-stigma and things to that effect, those things were not talked about at all. I think there may have been an inkling of maybe a couple of different cases where people had maybe talked about postpartum psychosis or something to that effect. And I saw media, of course, but nothing really touched upon or talked about postpartum depression. So around the 4th child, there was actually a murder in my family. My brother was murdered, and that happened during my pregnancy. I almost lost that pregnancy. And then right after that pregnancy, immediately I fell into deep depression and anxiety due to his murder. So after experiencing that, I really couldn't put a finger on it. I just felt like it may have just been motherhood. Like, this is what moms go through. This is what we experience. And I realized a couple of years later, I think about, my son was about 6 or 7. So I've been going through this for years at this point. And he came into my room one day and he said, "Mom, why are you always sad?" And I think I could have turned into stone at that point. Just hearing him say the words, I first of all, I went into a place of, he knows. Oh my God, he knows. Because up until then, I cried in the shower. I walked around with an orange do-rag on my head, and no one everybody was just like, okay, she's just mothering or whatever. Now I laugh at it, but going through it, breath stinky. Okay, first and foremost, okay. Flip-flops and sweatpants were the daily. I mean, there were signs and indicators there, but when you are around people that everyone kind of looks like you do, and everyone's kind of going through their own thing, and maybe depression is the norm around you, how do you know how to identify when there's something wrong? So when he came to me in the room that day, and I was just like, oh my God. And I said, it's not his job to worry about me. It's my job to worry about him. And so I remember getting up, going into my bathroom and looking in the mirror and not recognizing the person that looked back at me. And I realized at that point, something's wrong. I don't look like me. And it's amazing how you can be at home and be, basically with yourself, right? You do the things, but you never really look at yourself in the mirror. You never really take a moment to go, wow. And I'd been, I think, in a fog. I call it a mombi state. I was very much like a zombie, a mombi, where I was doing all the things, taking care of all the people. I was very active. I took them to school, did homework with them, everything, but I would always climb back into my well. So this is a bit of a trigger warning. If you've ever seen The Ring, I was like the Black version with braids, and I would come out like, oh, what do y'all want for dinner or whatever, right? Like go back into my well. And my well was watching reality shows in the dark in my dark room. And I realized that I had to come out of that well. So I started to do a lot of research, and I started to find out about epigenetics, about depression, about anxiety, just about our lineage. And I realized that, through the slavery, through the civil rights movement, for a long time, my excuse was, well, we've been through slavery and civil rights. So, maybe I'm just not strong enough. I'm just not doing enough. There's no way that we can go through all of that and still be here. And I'm complaining about nothing. Like, this is nothing. I shouldn't be complaining about this. But through my research, I realized that no, actually, we should have been in there a long time ago. And all of those things that we experience, they hold a heavy weight on us now. I'll speak for myself. They hold a heavy weight on me now. And just my experiences, the levels of stress that I was going through, being a teenage mom and taking care of several children. I think by the age of 24, I had 4 kids. That's a lot for a young adult to carry. I look back at it now like, oh, girl. But as a mom of 6 amazing human beings now, and well into my, I'm not gonna tell y'all how old I am, early 40s. I'll tell y'all anyway. I now look back on that time and I realize how much that person, that woman, that girl had to carry, and how I came out on the other side of that and became an advocate to speak up for women that are like me, come from where I come from. We're able to navigate the hoods and the places and spaces I was able to navigate and make it through. So now I speak on boards, I co-chair, I stand up on billboards and stuff and advocate for maternal mental health because I know the importance of it. And back then when I was going through it, I didn't have anyone to turn to say that person looks like me and is experiencing what I'm experiencing. For a long time, I just thought it was the other person's disease. It wasn't, Black women didn't go through this, Black women didn't experience it. So I say to all of you that you have a voice, that your story matters, your experiences matter. Keep your stress levels down as much as possible, and just know that you can get out here, and by telling your story, you can do so much and you can impact so many people. I have people that come up to me now in the grocery store. They're like, oh, I saw you on the news, or you came and spoke to our department at Social Security, as I used to do a lot of speaking with Stop Stigma Sacramento. And they were like, I remember your story. And that just helped me when I started to experience some things to know that I needed to ask for help. So now I tell dads, I tell, really anybody that'll listen, if you see something, say something. If you see a change in your partner, or if you see a change in yourself, to say something and stand up for yourself and to speak up. So with that, I will step back and hopefully if you all have any questions, I'm here. Thank you so much for allowing me to speak and share.
Thank you,
Thank
Jess.
you, Jessica.
Yeah, no, I appreciate starting with a share like that. I think vulnerability really helps for the conversation to go deep, shared vulnerability and compassion. And with that, we have a host of some phenomenal panelists here this evening who have an array of resources and experiences that I hope you all will find as valuable as we do, and that you share them along with others. So we are, Monica, did I jump the gun? Okay, so I'm happy to introduce our group of panelists here this evening. Although they are beautifully pictured, the order that I will read their biographies are not particularly in that order. So just take note of their names and their roles that they play. Dr. Twyla Dillion is the Executive Director of HC1. She brings 10 plus years of experience in the nonprofit sector, spanning philanthropy, Medicaid reform, maternal child health, data analytics, and academia. In her prior work at United Way of Greater Rochester, Dr. Dillion focused on using data and analytics across the fundraising, grant making, and evaluation cycle. Additionally, my apologies. Additionally, Dr. Dillion has conducted research on breastfeeding, served as program officer for maternal child health programs, and worked as a research lead on a patient-centered outcomes research institute. The project focused on collaborating with Black moms better to understand contributors to Black maternal mortality/morbidity and develop strategies for better outcomes. She is a graduate of the University of Rochester School of Medicine and Dentistry, where she received her PhD in Health Services Research, Policy, and Outcomes, and St. John Fisher College, where she received her MBA. Kairis Chiaji, owner of Braids, Beads, Bits, and Babies, is on a mission to lower infant and maternal mortality and morbidity in the African American community by increasing the number of culturally competent birth workers, helping them grow their businesses in this field, and mentoring them in civic engagement. Braids, Bits, Beads, Babies, and Other BS Beatitude Services is a sole proprietorship umbrella for a number of businesses, including catering, jewelry sales, and natural hair care. It affords Kairis flexibility to pursue her passion. Baby got backup birth support services. As a professional and community doula herself, she also provides birth support, education, and advocacy for birthing families. During the pandemic, she was inspired to begin training dad doulas so fathers could provide support with pride and excellence at births of their own children. Kairis began her practice as a birth coach in 1999 in Sacramento and continues to serve in Northern California. She and her global cohorts know this humble and hard work saves lives. Her motto, there are millions of unplanned pregnancies, but never has to be an unplanned birth. Kairis also has the honor of being the national trainer for doulas seeking the Birthing Project USA certification and currently serves on the BPUSA Board of Directors. She's also a foundation board member for the Sacramento Black Chamber of Commerce for the 2021 to 2024 term. And because fun and self-care are necessary, Kairis makes time for daily training with her horse, Namib and Naus. Oh, I'm butchering the name. Nausi. Please welcome her. Simone Taylor is the program manager for the Black Infant Health and Mutual Assistance Network, providing resources and support to Black mothers in the community. since returning to her hometown of Sacramento after receiving her BA in Psychology and Africana Studies from SDSU. She has been focused on advocating for wellness and maternal health in the Black community. She is currently attending CSUN to attain her master's in leadership and community development. And lastly, Janicia Rowland, restoration coach, trauma and equity specialist, MFT PCC, acknowledging trauma in order to become equitable, educate, enlighten, and empower. Janicia has obtained a dual master's degree as a marriage and family therapist and a professional clinical counseling from Brandman University, and is registered with the Board of Behavioral Science and MFT APCC with the Board of Behavioral Sciences. Janicia has also received a bachelor's degree in psychology and holds a minor in sociology from the California State University of San Bernardino. Janicia has over 15 years of experience and expertise working in education, trauma, and equity consulting, providing consulting and therapy services in K-12 settings, a trauma-informed care center, youth peer groups, and private practice. Janicia works with a diverse population that includes at-risk youth, students, parents, and educators as she supports all in creating inclusive and safe spaces to become whole. So we invite all of our panelists to come and share an enlightening talk with you all.
I can go first if y'all would like. I'm gonna lean in because I'm holding my infant right now. It's 9 o'clock, past 9 o'clock where I'm on the East Coast in New York State. I'm so glad to be with all of you this evening. I'll tell you a bit about Health Connect One and some of the reasons why this organization is really leaning in and how we're leaning in to support maternal mental health. So Health Connect One is a nationally recognized nonprofit training and technical assistance organization that uses innovative community-based approaches to support direct service providers in promoting the health of Black, Latinx, and Indigenous mothers, birthing people, infants, and birthing families. Together with community-based organizations and advocates, Health Connect One trains community health workers, including community-based doulas and breastfeeding peer counselors, and connects community-based initiatives and mobilizes diverse stakeholders to build policies and programs that improve birth equity. Our vision is to see birthing families thrive in healthy communities. We work to achieve this vision through an equity-focused approach, supporting the first 1,000 days of birthing families. One of the essential components of the model is to employ people from the communities we serve. This is a vital mechanism to mitigating the impacts of racism and trauma in healthcare and other systems impacting Black birthing families. These culturally congruent supports can relate to those they serve as they share lived experience and culture, a critical component in supporting folks. This work is essential right now as the impacts of behavioral health on birthing people and mothers have been exacerbated in recent years due to the COVID-19 pandemic and the following that. We've seen challenges around postpartum anxiety, depression, psychosis, and substance use disorders in many cases to mitigate the impacts of the other issues, so co-occurring conditions. We've seen really unfortunate outcomes that have spanned the United States. There have been so many stories of losing mamas as they've had experienced these different issues, many specifically around postpartum psychosis. Our work is crucial because we meet folks where they are, we understand the language and how we describe feeling differently than we normally did. Jessica, thank you so much for sharing that you looked in the mirror and you didn't recognize who you saw, right? That's not what we see on depression screenings. Right? Depression screenings aren't written for Black and Brown communities. You know, they're coming from an ivory tower. So when we're meeting people where they are, doing that grassroots work and understanding the language, understanding how we express that feeling that's different than how we felt before, we're able to support people in ways that are more meaningful and easier to connect. So I'll pause there. I look forward to hearing everybody with their lightning talks. I won't take up too much space, but that's primarily what we do at Health Connect One. I can add one more thing. So Health Connect One is also working with an MCO. We're working in California, specifically in Sacramento as well, to support capacity building and development within doula communities so that they're able to engage in doula reimbursement and to grow the skills that they have We will definitely make sure that we're including training around mental health first aid. That's something that's really important within the Health Connect One model that we're augmenting our trainings with. But in general, we're just really excited to be able to do some work out there, and hopefully I'll get out there soon. So just excited to be here with all of you, and looking forward to hearing more from everyone. Thank you.
So would anyone like to go next on our list of panelists?
I'll go. Hello, everybody. My name is Kairos Chiaji, and I have the incredibly privileged experience of being a doula in Sacramento area for the last 23 years. They asked us in these lightning talks to make clear this connection between the work that we do and how that is tied to maternal mental health. I'm going to say something, and it's something you've heard 1,000 times. What doesn't kill me makes me stronger. Guess what, y'all? What's making us stronger is killing us. The most common symptom that I have found, the first sign of mental stress, is a broken heart. They call it stress. And in general, Black pregnancy isn't met with joy. So often, a baby's first emotional message from the womb and the environment surrounding that womb is mistake. As a birth coach, I get to break that. It might seem like it's overreaching to anyone who doesn't know, but here, even in the great state of California, Black women, Black babies are 2 to 7 times more likely to die, to have a poor outcome, to have a traumatic experience, to come close to dying. And it doesn't change based on our situation. Your income, your education, none of that has an impact. In other words, Michelle that you went to 7th grade with has the same birth outcome risk as Michelle Obama, and vice versa. So what does that mean? It's just numbers. Let's make it make sense. With those kinds of outcomes, that means that a Black woman with a college degree has a higher risk of a poor birth outcome than a white woman living in a homeless shelter. Cuba has better birth outcomes than Black women in the United States. But let's bring it on back closer than that. We tend to think 6.5-pound baby is normal. It's not. It's common, but it's not normal, because our babies are born at 6.5 pounds because we stress out due to systemic racism all around us from every direction, and we deliver at 38 weeks. Social support saves lives. Advocacy saves lives. Having a safe space to be broken and to seek healing saves lives. And as a doula and a part of a care providing team for birthing families, we get to spend more hours than any other member of the team. I have seen, especially during COVID, postpartum depression, baby blues happens. Postpartum psychosis is on the rise. But having a sister who can navigate systems, medical systems, resource systems, all of the systems that we are required to engage in order to function in these United States, it reduces stress. And that stress reduction can allow a woman to carry her baby closer to term and to manage the outcome if she doesn't. It also allows the natural mood lifters that the hormones in pregnancy create to improve a mama's mental health. What's more, Every baby girl who is born with every egg she'll ever carry, which means a mama who is pregnant with a baby girl is the home of 3 generations. So as a birth worker, as a pregnancy coach, as a doula, we get to impact the start of 3 generations at a time in a good way for mental health and mental wellness. The other side of that is when something is going wrong, when something's not right. We are there that entire year postpartum. And having spent so many hours with the mamas, with the families, we are able to recognize declines pretty quickly and make those referrals to the resources that will allow her to address it and feel safe with care of somebody who looks like her from her own community.
That was beautiful, Kairos. Thank you so much. I just love the openness and vulnerability of all of your expertise and really why we are here today. I would like to next pass it over to Simone Taylor from the Mutual Assistance Network.
Thank you so much, Monica. Good evening, everyone. My name is Simone Taylor, and I am currently the program manager for our Black Infant Health Program at Mutual Assistance Network. And just wanted to first give some information what we do at Black Infant Health. Starting with Black Infant Health is all across California. So if you're joining us and you're like, oh, wait, I'm not in Sacramento, we have Black Infant Health in 16 different counties here in California. And we are providing not only the support and resources to the families, to our moms, but also give a different on their pregnancy. And so that we provide a support group where our Black moms are able to meet with other Black pregnant here in Sacramento County. Because of COVID, we were doing everything virtually. Hopefully we're gonna get back in person soon, but we meet for 10 weeks together prenatally, and we're giving them information about advocacy. We have a mental health professional in-house that is checking in on the moms when they first get into our program, letting them know, breaking that stigma around mental health, right? And then we also have our family health advocates that are meeting with our moms on a weekly basis, checking in, seeing what is your support system like? What is your birth plan like? Can we connect you to doulas like Kairos, right? Because we want to make sure that our community is strong and build that support system for our moms and build that support system that they're able to get back to. Our moms are checking in with each other. How is your pregnancy going? I'm 37 weeks and I'm excited. What hospital are you delivering at? And that type of support from another Black woman through Black Infant Health is what we're here for. Another portion of that, again, is just meeting with them throughout their time in postpartum as well. So once our mamas have their babies, they're able to come back together and still be able to talk about it. We're talking about mental health even more now. We're asking, where is your support system? If you don't have one around you, we are here to provide it for you. Connecting them to other mental health services here within Sacramento. And also in our groups, we're talking about mental health. How do we break that stigma? We're talking about self-care practices. We're talking about doing meditations. We're doing yoga with them. We have specific events just for our moms to really take care of themselves, get away and be with other moms and have that conversation, and also really just get vulnerable, right? There's things that come out to our mental health professional that our moms are not telling their advocates, and we're able to create that wraparound services and support for them, and really just them from our own experiences as well. And so being in the community, Black Infant Health being at community organizations like Mutual Assistance that are connected to Black Child Legacy, to create a whole pathway for them. And even our mom Black Infant Health Program ends at 1 year old of a baby being 1, you're able to get connected to all of our other resources, because sometimes our mental health and things that are happening are not just because we just had our baby. Kairos mentioned there's relationship things that are going on. We have different parts and pieces of our lives, and our community advocates are able to help our mom's life plan through it, set goals, really get down to the root of understanding what your mental health is and how to take care of yourself. And so that is what Black Infant Health does. That is who we are. And we're here in the community, and we're just wanting to make sure that our moms are feeling good and being supported by other Black women, because we have a belief that nobody can support a Black woman the way another Black woman can. Thank you.
Thank you, Simone. Love the quote at the end. Wholeheartedly agree. And so last but not least, I would like to pass it over to Janicia Rowland to share some information about her expertise and her programs.
Good evening, everyone. I'm excited to be here with you all. Just listening to how you all shared about your experiences and what your organizations do. It's very, very, very encouraging as well as empowering. And so the name of my company is Restoration Coaching. I am the CEO and the founder of Restoration Coaching. I provide life coaching. So it's actually restoration coaching. With restoration coaching, it is life coaching with a therapeutic and spiritual lens. And so it's being able to co-create those safe spaces for everyone to come in and being able to discuss, as you said, those real life experiences in a safe space. And so I'm just thinking of, when I was listening to everyone speak, I was thinking of the different experiences that I have heard of in our co-created safe spaces. As I said, I'm a therapist. And so when it comes to mental health, again, in connection with maternal health, I've heard of so many stories around postpartum, around trauma, depression, anxiety, self-esteem, losing yourself, while pregnant, prior to being pregnant, as well as the impact post after pregnancy. And then understanding, as someone shared earlier, in regards to the relational aspect of things, there's a lot of prevalence around relationship loss, right? Divorce, separation, being alone in the birthing room without your partner is huge, huge. Like I said, very prevalent in what I'm seeing. When it comes to the equity piece, I'm an equity and trauma consultant as well. So I do a lot of professional development and education, as well as organizations and with corporate as well. And so when we think of maternal health and equity, I think of access, right? Access to resources, access to knowledge, access to education. Sometimes we don't know what we don't know, and we don't know what to ask as a Black woman. That's part of my personal experience, having 2 children and going through the birthing process, not knowing what hospital to choose, not knowing, what questions to ask, even down to, again, the traumatic aspect of things when it comes to sexual abuse prior to going into the birthing room, doctors not knowing, right, because those questions weren't asked about prior experience or exposure to that sexual abuse and that PTSD that can happen, right? Those triggers that can happen when we're going through this birthing experience. And so another thing that I hear a lot of in these spaces that I co-create is miscarriage, walking through miscarrying and walking through that process of wondering, should I get pregnant again? Right. And when I say this, I mean, again, those co-created safe spaces that I create with clients. And so with restoration coaching, the connection to maternal mental health is being able to hone in on all of those aspects that I discussed, and being able to create spaces such as this, right? Giving that access to webinars such as this, so that clients and Black mothers can have access to supports and understanding what a support system looks like, right? A lot of us, and I'm speaking of those who, based on my lived experience, understanding what support systems look like. And so, again, I'm just excited to be here and offer, again, with restoration coaching, professional development. And this whole platform has actually encouraged me. And I created a presentation on Black maternal mental health, to be able to go into healthcare and being able to support our Black mothers, but being able to speak to doctors, being able to speak to nurses, being able to speak to those in the healthcare staff to understand the connection between the two and the cultural aspects of things. And so again, thank you so much for allowing me to be here on today.
Thank you so much, Denicia, and to all of our panelists for today. This is really just so exciting hearing the versatility of what we can all bring in addressing maternal mental health. And so I would like to actually kick us off into a Q&A session. And again, this is for our audience to be able to ask any questions that you've heard throughout tonight's program to all of our panelists, as well as our other speakers for today. You know, we have such a well-rounded group of team members, and I really want to be able to make sure everyone has that opportunity to share and provide additional insight. So again, my name is Monica Nelson. I'm the program associate here at the Center at Sierra Health Foundation, and I support our Black Child Legacy campaign, as well as our trauma-informed wellness program. So I have a few questions that I wanted to start us off with. And for our audience, the best option is to write in the Q&A box directly at the bottom of your screen, but our team is also reading the chat box in case there are additional questions asked there as well. So feel free for any of our wonderful panelists today. And I'm going to tie into Genesia's portion, where the first question we have for today is, how can I make the process in finding a therapist easier? It sounds like there have been folks that have noticed that it's a difficult process, timeline, locating someone that's directly in their area or demographically and representative of who they are culturally. You know, how would we be able to make this process easier in locating a therapist?
Absolutely. So that's a great question. The first resource that I would provide is Psychology Today. So with Psychology Today, they have a search box where you literally can type in your city. And now it's updated to the point where you can type in Black male or Black female in order to hone in on the specifics of what it is that you're looking for. There's also being able to look for resources. So Google is huge, right? Googling specifically what it is that you're looking for. So in our situation, if we're looking for a Black therapist, and I will tell you, when a lot of most of my clients that are Black women, majority, I would say majority of my clients now, about 70% are Black women. And when they found me, they talked about how the process was very, very challenging to be able to locate a Black therapist. And so another platform is Black Therapist, I believe it's blacktherapist.com. So that's another resource to be able to look on. But just being able to Google specifically what it is that you're looking for by Psychology Today is one of the best resources. Also, being mindful and prepping your thoughts, knowing that it is a journey and it may be a journey, right? It's not a destination. And so being able to understand and preference your journey in, okay, this is what I'm looking for. So honing in on the specifics, maybe writing out a 3 to 5 point list of characteristics or attributes that you're specifically looking for, and then being able to go on Google or using a platform to locate based on your specifics. One other point, being able to call your insurance. So if you flip your insurance card over, you have the customer service number, contact the customer service line, and then ask them specifically for a list of therapists, psychiatrists, psychologists, whatever specifically that you're looking for. And then again, like I said, with prepping your mind, going through, understanding that it is a journey, it's kind of like a relationship, right? You're not going to just date anyone. And so being able to understand that it's kind of like that process, being able to kind of weed out, what it is that you're looking for and understanding that it is a journey.
I
I would
wanna
just
mention-
throw in there too
Britta.
that, oh, Jessica. That's really what our Be Mom Aware site is all about, is providing a more direct and informative experience in searching for a therapist. So just like Coach Jay said, Psychology Today, therapist.com, Therapy Den, Black therapists. There's even one for Latina therapists, Latinx therapists. Those are all really great resources, but not all of those resources are tied necessarily to our insurance, and therapy is expensive. So knowing your rights around being able to access mental health care through your insurance provider is critical. There was a law passed in 2020 where all insurance companies in California are required by law to provide timely access for maternal mental health care. So that's anytime for conception through 1 year postpartum. And if your insurance panel does not have somebody that fits your needs, like Coach Jay said, making that list of things that you need in a therapist. And if you need an African-American female therapist, then that's what you need. And there is another law called the class standards for cultural language access services that requires companies federally to provide you with appropriate cultural services. You can request an out-of-network provider, which means that your insurance company will still have to pay for that service, but it will open up you to a larger range of therapists that would be able to see you, and possibly increase the number of African-American therapists that you would have access to.
I dropped a couple things in the chat. That's really helpful information around the insurance coverage. There's other laws as well around mental health parity just in general. So there's certainly support, but being knowledgeable about that is definitely a plus. Beam Collective is an organization based in LA that has a directory as well of Black therapists, yoga teachers, doulas. There's loads of different folks on there, so that's a good resource. And then I think very recently during Maternal Mental Health Week, the Health and Human Services launched a hotline. Now I haven't called the hotline. I don't know how good it is, but I think that folks need different resources because not everyone is going to go to the same, places. So that provides, I think having just a list, right, could be helpful for people who support others who may be having some of those mental health challenges. And a hotline can certainly be helpful in a crisis to help someone to de-escalate or to find other resources as well. So I dropped that in the chat.
These are great. Thank you all so much. And in fact, I think our next question really supplements where we're currently at. So to add to that, there's a question as to where can teen mothers get support, especially those that are experiencing trauma, adverse childhood experiences, stigma, and even the potential of homelessness, if anyone would care to answer.
Definitely. I would say for Black Infant Health, we have that age requirement that we meet, the 16 and over. We're able to case manage. We have connections to resources for housing, whether it's, finding a homeless shelter that's for prenatal, or if there's other housing resources we can get to them, getting them connected to job support as well, and just making sure that their home life and everything that's supporting around them is solid and together so that they are able to have a healthy pregnancy. So definitely you can refer them over to Black Infant Health.
I'd also like to bring Black Mothers United and Her Health First to the conversation. The pregnancy coaches there are amazing for supporting women of all ages, and teenagers especially have a soft place for us. And some of us were pretty young becoming mothers too. So that is an option in addition to the doula services. And the doulas at Her Health First are definitely prepared for trauma-informed care and support at no cost to the participant. So we will take all of your teens, we'll take all those babies and love them to having their babies.
Great. So the next chat question I have is, how can a mother be supported who knows and recognizes that they may have postpartum depression?
That's kind of a loaded question. It can be answered in a variation of different ways. Can I get a bit more clarity on what exactly they want to know, if you're still here?
Sure. So this sounds like it's from a health provider. So how can a health provider specifically support a mother that comes in and says, I think I have postpartum depression?
Got it. From a provider standpoint, it's just to validate her and just let her know that you're listening and that you hear her. I think for during our research and our focus groups, we heard from a lot of mothers here in Sacramento that they were telling their providers that they weren't feeling themselves. And a lot of their concerns were dismissed as either baby blues or you're just going through whatever you're going through right now, and they weren't validated. So just listening and understanding how to communicate. If you are not, if you're speaking to a mother who is of a different culture than you are, then understanding and taking the necessary training to be prepared to have that conversation in a way that they can, number one, you can say it and they'll know and understand that you're on their level and you're trying to speak to them in a way with compassion and empathy. I think when you try to either over talk or overdo it or not do enough, either of those two can be dangerous to where they don't trust the system anymore. So you just have to make sure that you're walking that very, very fine line, but then training yourself and having the knowledge and the information in order to let that mom know that she's the expert on her body. You hear exactly what she's saying to you and what can you do. And I think pretty much what I'm saying here is ask her, what do you need help with right now? How can I be of assistance to you? But listen to the answer.
I would also add in there too that asking them about what they're currently receiving and if that's working for them, because oftentimes there's a misconception that just because they have people in their lives, that equates to support. And that's not always the case, because one of the things I hear a lot from birthing women is that, oh yeah, I have support from my partner, but only when he gets home from work, and he doesn't get home till 8 o'clock, and then he goes to bed at 10 o'clock. So what, is that really support, right? So that may be the best that husband or partner can do at that time, but that opens an area of opportunity to possibly, reach out Black Infant Health, to Her Health First, to these wonderful community organizations. So dig a little deeper so that you really understand how that person is seeing their world, right? And they should be doing most of the talking, right? I think kind of Jessica alluded to that, is if you're telling them how it is, that's the misstep, right? They should be telling you how it is and you accept that's real, that's the truth. There's no ifs, ands, or buts about it. And then how do we give them what will be most helpful to them? And that there is no one prescriptive approach, because what's going to work for one mom is not going to work for the other mom because of just life circumstances, their personality, a variety of other things.
And I just want to add that most of the stuff that you need in those situations, you will not find in any books. None of your medical books have it. But I can guarantee you that if you reach out to some of the community organizations or even the advocates in your community, because you've had them in your offices before, and make sure you keep those connections, that together we can work together to deliver exactly what the mom needs.
I would add to that, backing up before you get to the point of a client or a patient in crisis, and understand that if your assessments don't catch what's going on, like the moment that we're referring to now, where a woman says, I'm having an issue, it didn't begin in that moment. And if your assessments aren't catching it, then there's something there's a disconnect in the conversations with the perinatal services, with all of these things. So please talk to your staff, the folks who do the blood pressure checks, who do the get you in, change into the gown, who do the checklists on the check pages, that there needs to be genuine connections there if a crisis is going to be reported back to you. The other thing that I would ask is that you be courageous enough as a provider to say, I know that I'm probably not what the person you would naturally go to. What does that look like for you? Who can I help you connect to? Those two things will build a trust in a way that your patient or that your client would be willing or more willing to bring it to your attention when they're struggling.
I would also add one last thing, being able to, which we're doing here, building those relationships, as Kyra said, outside of the healthcare facility, right? Being able to build partnerships with therapist agencies, right? So that when patients come to you and this is the response, being able to say, you know what, I have a number for you. Being able to say, we have a relationship or a partnership with this therapist or this agency or organization, as you all shared earlier, so that it is a smooth transaction or a smooth transition, so that they feel supported in that moment, if that's exactly what it is that they're looking for. As you said, going through that assessment and identifying what it is that they need.
Great. So thank you all so much. I know that there are a few more questions in the Q&A, and I do want to ensure that we're able to keep us on time for today's agenda. And so I asked just in this next part if we could perhaps just have one answer for our remaining items, as these are really great questions. So, kind of tying on to the previous topic, what would you say is a word to encourage Black women that their children will not be taken away from them if they're recognizing they have postpartum depression? I think there's often the understanding that a lot of communities of color have some apprehension in the medical field. So if we could just have one of our panelists say what you would say to encourage a mom that she wouldn't be reprimanded.
I would like to hop in with this. Something that we say often in Black infant health is you have to fill your cup up first. You cannot give anything to your baby, anything to your family if you are not whole. And so take that time, you'll be okay. You have a village supporting you. If you don't have a village, let us come around and be your village. Let us build those building blocks so that you have that time to pour into yourself, because your baby needs you, especially in that first year of life. You are their everything. And so if you're not okay, if you're looking in the mirror and you're not seeing yourself right, we have to make sure that we pour into you and help you pour into yourself to get there.
Perfect. Thank you so much, Simone. And the next question is, has anyone here supported the trans community during birth or postpartum? And if so, could you share some insight if there are any differences to some of the other clients you serve? And what are some of the best practices to support them?
I have some experience supporting trans clients, and I think the biggest thing is around language. Some trans patients still want to be referred to as a mother, even though they biologically identify as male. So really getting them to set that tone is really important. Also making sure that they have a supportive community around them. Do they have people that they trust, that they can go to? Do they feel safe in their environment? These are often large concerns for the trans community. And how to support them best is really just to acknowledge that they are in a unique position, and how do they envision their future, and connecting with an appropriate therapist if they need to work through any postpartum mental health issues that they might be having, because the hormones and things that they're experiencing as a postpartum person may feel very disorienting to them as someone who has worked, maybe depending on where they're at in their transformation process, to becoming a male. And having had to stop that and possibly regaining some feminine physique can also be distressing as well.
That's really helpful to know. Thank you so much, Brenna. And so I'll ask our final question before we move on to the next section. So how long do postpartum symptoms typically last after childbirth? Do they develop immediately, or is it as far as 1 year after having a baby? If anyone could care to share.
So I would have to ask that you clarify when you say postpartum symptoms, because if we're talking about postpartum depression, that's something different than the overall impact of having a baby and your body transferring hormones and making changes to go from pregnant to unpregnant. Which part would you like for me to speak to?
So the question is, how long do postpartum symptoms last after childbirth?
If I answer with an understanding that the question is referring to postpartum depression symptoms, that is not a one and done, and it is not a linear process. If someone has postpartum depression, meaning that the chemicals in their brain have made an adjustment that puts them into a depression, it would come in waves or stages or phases, the same way as depression does for folks who are not pregnant. And so, like many processes that we go through, they can be good on some days and not as good on others. There are things that we can do and that can help. For instance, feeding babies human milk releases hormones in the parent that counter depression and allows them to feel better physically, their own body kind of addressing the change in the brain chemicals, the brain chemistry. But they can last for days or they can last for years, which is why having those relationships and staying connected and providing that support and removing stigma is really, really important. I have seen where somebody who now has a toddler is sort of judged pretty harshly over still responding, reacting to being depressed. And the rest of the world is saying, it's been a long time, get over it. That's a really, really dangerous take. And so there isn't a time period or cutoff. If someone is depressed, they are depressed and it will last as long as it does. And we continue to support them and point them toward resources, the specialists and the medical providers who can help them address that in terms of the physiological side and the mental and emotional side.
Wonderful. Thank you so much, Kairos. And again, to all of our panelists, this was just such wonderful understanding to the multitude of maternal mental health. And I'd like to use this time to transition us over to our first resource share. So allow me to move on to our next section here.
The What's in Your Mama Bag, correct?
I think we're having a resource share from the Sacramento Maternal Mental Health Collaborative before we have one from TWIP, Amaya, from the Trauma Informed Wellness Program.
Got it. Thank you for that prompt, Shelley. So as we had mentioned before, Be Mom Aware is the project of the Sacramento Maternal Mental Health Collaborative. It's designed as to be a one-stop shop for all things maternal mental health related. And it does focus very pointedly on the African American and Latina communities. because we know that they are disenfranchised, and we know that these communities often are neglected in terms of having appropriate resources for them. And so we want to make sure we're uplifting those communities through this Be Mom Aware project. So the things that you're going to find on our Be Mom Aware website are information just about what is maternal mental health, that it affects, 50% of birthing women who have a maternal mental health condition, it's their first time ever experiencing a mental health condition of any kind. And so that can be very jarring and very upsetting for the individual and confusing for the family, because they're like, my partner, my daughter, my friend has not been like this before. I don't know what's going on. There's also information on how to build your support team. We have 7 steps to build a rock solid support plan, and just all the things that you need to know, and your family and your friends and whoever is in your life supporting you need to know. We also have links and connections to all of the wonderful agencies like Black Mothers United and Black Infant Health, as well as others in the Sacramento community that can really be part of your support plan. Understanding just why it exists, like how things like toxic stress, epigenetics, hormones, the quality of your relationships, things that you can't even control, like from how you were raised and the community that you grew up in, can just have an influencing impact on what happens when you give birth and after you give birth. We also have, again, our care connector to help you really understand your rights, and also for providers to understand their responsibilities in addressing maternal mental health from the first time that you enter a provider's office, right? And we also want to make sure that our birthing communities, people who are of reproductive age, know about these things even before you have a child, right? Even before you become pregnant, being aware of these things, because the earlier you can detect it, the earlier that you can speak on it, the better success that you're going to have in really creating that solid plan, so that if you do find yourself in that well, like Jessica spoke about, you have people, you have resources, you have things, you have tools that can help you and assist you out of that dark place, right? We also have, of course, crisis information for anyone who is experiencing a mental health crisis and maybe needs a more higher level of care through hospitalization and things like that. Family planning is super important, and even though half of pregnancies are, theoretically unplanned, there still can be planning that happens, from that point forward, and building connections with these community resources providers, or even with your OB provider's office. I work in an OB provider's office, and that's my role, is to say, okay, what are you bringing to the table right now? What do we need to help provide you with or guide you towards, so that you can meet your goals for where you want to be by the time you deliver? And maybe that's managing a health condition. Maybe that's working on a relationship. Maybe that's making a big change of, like, I'm in a bad situation and I need to change everything in order to be where I want to be in raising this child. And if you are in a provider's office that has a social worker or somebody who fulfills that role, building a good relationship with them is really important. But our website really gives you all that information about what you need to know, and really from that cultural lens too, right? Because we know that there's the shame, there's the stigma, there's all these things that exist that can be psychological barriers that can prevent us from really taking that step forward. And we want you to know that we see that, we understand that, and there is a way through that.
Yeah, and I think a huge thing I just wanted to say about our website is that this is from the lens of moms. So while we have physicians that went through and kind of looked at things and helped us speak to the physicians, we definitely created this site with mothers in mind, from our own lived experiences, both in work and in personal.
Thank you both so much. Great organization, and I see that you've inserted the website in the chat. So again, for our audience, please feel free to use these moving forward. I would now like to move over to Amaya to be able to share more about the Trauma-Informed Wellness Program.
Thank you, Monica. So the Trauma-Informed Wellness Program, I'm excited to make a connection with you all. While we don't primarily focus specifically on birthing people and pregnancy, maternal health, we do really work to serve the entire community, specifically looking at Black communities throughout Sacramento. The Trauma-Informed Wellness Program consists of 4 community-based organizations that are strategically placed so that people have access to trauma-informed wellness services and programmatic activities that are free to you all. Those partners are Improve Your Tomorrow, On Track Program Resources, Roberts Family Development Center, and Rose Family Creative Empowerment Center. And we are in year 2 of our 3-year grant. Our mission is to, we envision a revitalized and healthy Black Sacramento. We believe that this is possible through an increased sense of agency, connectedness, and awareness of health and wellness needs, through greater participation in support services, and by developing a trusting relationship with mental health service providers. We envision mental health service providers that are actively seeking to understand the context of mental health needs prevalent in Sacramento's Black communities, that develop programs and services in response to those needs, and provide intervention as well as preventative support to Black individuals and families. And so our mission, to realize this vision, we are committed to educating the public on common mental health needs and wellness practices for Black people in Sacramento, supporting access to culturally responsive mental health services, building the capacity of mental health service providers to identify and be responsive to common mental health needs within the Black community, and lastly, ensuring that service providers maintain an accurate account of the context of mental health needs in Sacramento's Black communities. So it is an honor to partner with you all today. It is an honor to connect the work that we have been doing and collectively doing on both prevention and early intervention work, largely in schools and or offering connected services to mental health service providers through the county. And we have a special video that I would like to share with you all as part of our partnership with the Trauma-Informed Care Culturally Responsive Therapists through the county. So I will just take a moment to share that with you all now. And Monica, it will give me, give me permission to do it. Thank you so much.
Hello, my name is Sonia Howell. I'm a licensed marriage and family therapist with Cluster B Family Therapy, Inc. My area of expertise actually is working in the field of trauma, whether that's the LGBTQ community, individuals, family, child welfare. Any African American person can receive services through Sacramento County. The services are free, 12 individual sessions. One thing I really want the Black community to know, that there are trained mental health professionals out there that are available, there to help, to listen, to support, to become part of that healing process, or just to be an ear and a space for you to talk, to find resources, and to gain knowledge and information. I think we are at a place where there's awareness of systemic racism and how that has played a part in accessing mental health services, and or a part of why we are coming together and saying, hey, I want to be able to talk about this, whether that's microaggressions in your employment, or that is seeking mental health services and not seeing someone who looks like you on the other end, not feeling understood. I think because that transparency is coming to light, we're talking about it more in the workplace. We are expecting it more, and we know that there's somewhere that we can go, that people are not alone in that space. I do see hope, and I do think that that we are growing. You can always reach out to us by email at clusterbinc@gmail.com. You can find us on our website at clusterbinc.org. You can also reach out to us at 916-269-3506. Know that you're not alone. Cluster B Inc. is here for you. Thank you.
Thank you. So I wanted to share that with you all today as a resource. This is part of a project. It's connected to our mission and our goal to make connections with other service providers and to bring our knowledge and understanding of what's happening on the ground to those providers so that they have an accurate account of what's happening and they can adjust and make be as flexible as they need to be to serve the people that we have that are our gems in our future, right? So thank you. I will share in the chat our webpage along with the information for that particular therapist, as well as the others that are a part of that collective. Monica.
Thank you so much, Amaya. And just to add, I see a question in the chat that actually tied into that, and I hope that really pertained to the video. Amaya, someone was asking if grief support is also, provided in the maternal space. And so just if there was anything else you wanted to add, I know that has come up in your line of work before we transition.
So, well, we don't directly support maternal health. So I would like to open it up to others. I know that Robert's family and Mrs. Roberts, I know you joined the call at one point. She has taken Robert's family. So each of the different community-based organizations that we are, that consist and construct the trauma-informed wellness program have different services that they offer. And so not all of them primarily focus on maternal health. However, all of them focus on wellness in some capacity. And so our dream is to create a system, if you will, where we are sharing those resources that people can go to one particular organization and be connected to all of us, right? And so grief support and counseling is definitely a major focus of ours this year. We want to challenge the discourse of trauma to be more grief-centered and grief-focused, because we understand that even the language of trauma can be limiting in how people think about how to resolve what's happening, right? Grief is ongoing and omnipresent, and there's not a linear process for which you grieve or what is expected from a griever. And so language is important. And being able to have spaces where we normalize conversations around mental health and wellness, where we continue to talk about and name and own the ways in which our experiences are in our challenges are driving decisions in our lives and or in some cases creating a ruckus, right? That not all conflict is bad, not all passion is bad, right? That we reclaim our language for ourselves and use it to help drive the work that we need for our people. But I'm going to open it up to all of you who may actually do that grief work with maternal.
Thank you, Amaya. That was a really awesome explanation. I just wanted to add, and I see Mrs. Roberts has dropped into the chat that at the Roberts Family Development Center, they do have counselors in the network that specialize in grief. And I'll also just share within the Black Child Legacy Campaign, there are 7 community incubator lead sites, and those are throughout 7 neighborhoods in Sacramento. And one of the common referrals that the staff at the CILs make is for counselors and therapists, as Ms. Roberts just shared. So there are counselors that do specialize in grief, but therapy referrals are a common referral that are made through the Black Child Legacy Campaign also. So there's plenty of opportunity to connect to those services and really get that, just not the conversation, that practice of normalizing therapy when it's needed.
Thank you so much for adding that. And by all means, everyone in our audience, feel free to type any resources you have in the chat. Very helpful. So I'm going to move us on to our next section of today's agenda. And excuse me. And for this opportunity, we are going to be doing a brief, activity just to be able to share a little more about what is something that can support us as we learned all these wellness techniques and practices. So what's in your mama wellness bag? And I will now pass this over to my team.
I think Brenna will partner in this, but this is a question for the audience. We really want to engage you in this event. You all asked such beautiful, really thoughtful questions. And so this question is for you. What do you do, those of you who are mamas, or maybe you've seen a friend or someone in your community have some really great resources to help support them through their motherhood and parenting journeys? What do you have in your bag? Can you share with us so that we can share with the rest of the community that's here that will listen to this later as well, about how they can support themselves through motherhood? Brenna, did you have any other questions to add there?
No questions. I was going to say, just, while, our audience is kind of digesting that question, I'll say for myself, in my mama wellness bag is getting some time to myself. Prior to having a child, I was definitely someone who needed my alone time to rejuvenate and recharge. And that did not change in my personality after having a child. So being able to even just get a 30-minute walk, or go to the grocery store or Target by myself sometimes is enough alone time just to be able to reset, right? Another thing I have in my mama wellness bag is I like to knit, and I find that very cathartic and relaxing. And would love to hear from our other panelists. What's in your mama wellness bag?
I just wanted to add that we have something in from the chat, learning about and this is coming from Keys Patterson, learning about your endocannabinoid system. I'm not sure what that is, but learning about your endocannabinoid system and how it impacts our biological, psychological, and social wellness. That is in Key's wellness bag. One of our partners from the Healing Network has shared my mom's support in McDonald's app, so I don't have to cook all the time. That's real. Sometimes you don't feel like cooking and you have to have those quick things that you can eat and just grab onto. And then we have another resource shared by Amaya.
That was great. Thank you so much. I'll pass that over to you, Maya.
Oh, no, I was just sharing Sonia Howell, the therapist, her information, as well as the webpage that you can find her in case anyone wanted her information.
Thank you. Yes, share resources. That's what we're here for. And
Can I share really quickly what's in my mama's wellness bag? It's really quick.
Of course.
Okay, there's candy and music. Okay, music that only I can listen to, that I need to just get crunk to sometimes. And I just need to release a lot of Tupac. But then there's also some classical music when I just don't want to hear any words and I just want nice instrumentals. So I wanted to just put that out there.
And you gave me an idea, Jessica. I actually wouldn't mind sharing because I am not a mother yet. And so for me, my wellness bag is hearing from you all. It's really great to have people be able to share their own experiences while also having my own interests in maternal health and knowing the importance of womb health and preparing in advance, making sure I'm being vocal about stressors in my space to prepare me. And so I just thought that would help as well for anyone who has yet to have children, but is foreseeing that in the near future. So
May
One of
I
my-
share as well? Oh, go ahead.
Yes, of course.
So I love the Mama Wellness Bag. I would say my therapist, going through my education, my professors would always tell us, never see a therapist that's not seeing a therapist. Because as therapists, we need to be able to receive that support as well. And lastly, I would say water, any type of lake, waterfall, just hearing the fish tank, right? It kind of grounds me. And so anything dealing with water is in my Mama Wellness Bag.
I keep a calendar in my Mama Wellness Bag, and that is so that I intentionally schedule my self-care, because waiting for the opportunity and the resource and the inclination to all hit organically is a setup to not do it. So I would encourage everyone to have your calendar schedule your self-care. Mine personally really is getting out and training on my mares. It is physical. It is something that challenges me, but also gives me joy at the same time. And so literally putting that on my calendar every day is how I create enough space in my brain for my emotions to move around and sort themselves out. And then I get to decide what to do with them.
And AA Healing Network put in, other non-judgmental moms are also in my bag because these kids, man, and I feel that so much.
I just wanted to hop in and add for my Mama Wellness Bag, and this is directly out of the bag, my journal. So I can definitely just write out how I'm feeling, release it, put down what I want to do, my dreams, my goals. This journal has it all, and I feel like that's something super important to keep me focused and on my wellness journey.
Can I provide one more resource? Because I'm thinking of tools that the audience members can use. So when it comes to different symptoms of anxiety, depression, things of that nature, what I come to realize is Pinterest is actually a great resource. There is something called 101 Ways to Cope with Stress. And it gives you 101 ways, from baking to taking walks. And sometimes when we're in those stressful situations, it's hard for us to emotionally adjust as well as mentally adjust. And so being able to just access something very quickly and looking through a list and saying, you know what, that interests me. Let me go ahead and do that. And so Pinterest is a great resource that I use to be able to just literally type in depression, anxiety, and a lot of different techniques and tools come up in order to help you through, but also therapists.
I'll add also, I'm not a mama yet, but something in my wellness bag is just breathing, just taking those moments to pause and just be still, even if it's a busy, quick day. Just taking those moments to sit, be still, stand, be still, and just take a breath, open the patio door and breathe, getting fresh air. But those moments of pause are always really powerful for me.
And I will have to add, you can probably see them behind me. My plants are in my Mama Wellness Bag. I also put in the chat physical activity and healthy eating. I feel like all of these things kind of go together, and just having a space that is my space. My kids come in here after I'm done for the day and they sprint back and forth, but while they're at school, this is my space. and I really savor that.
And I would like to share, I guess, I'm like, man, the mama bag, y'all got me really touched right now. I'm bringing up all these things. My youngest is 4, and I forgot a lot of things in my Mama Wellness Bag when we went to the hospital, because I was shocked that we were actually in go at that particular moment. But I kept my phone, which was my lifeline to my family who was not near me, to my loved ones, a way for them to connect with me and get updates. And honestly, with my first child, hypnobirthing really helped me as a meditation before bed, and to visualize, because I knew it was going to be a battle to actually have my body open up, and I would have to surrender to that process. And mentally, I had to prepare myself for what that was like. A lot of a lot of, I think, just comforts, things that brought me lots of comfort. But thank you for asking that question.
That was beautiful. Thank you guys so much. This is just so insightful. I'm loving all of this. And again, thank you, audience. You know, we're almost done wrapping up, but have just a few more activities. So I appreciate all of you staying with us tonight. I would now like to pass it back over to Brenna to be able to share some affirmations just to really encourage positive parenting. So I will now pass this over to Brenna.
All right, thank you, Monica. So just like our grounding at the beginning, I feel it's important when we're talking about such heavy and possibly triggering subjects, just to have a cleanse, right? So Monica's going to play just this beautiful scenery in the background. And I just want you, if you're to find a comfortable position in your body, just someplace your body can fully relax. And then when you feel comfortable, closing your eyes if that feels good for you. Then take a deep breath in through your nose and exhale completely through your mouth. And take another deep breath in and exhale. And allow your breath to return to its normal rhythm and feel your body relax. Affirmations are tools you can use to calm your mind and relax your body. Our thoughts create physical responses. When you have positive thoughts, your body has the physical response of relaxation and peace. As we go through these positive parent affirmations, please listen to each affirmation without judgment and repeat it silently to yourself. My body is completely relaxed. I am strong and healthy. My child feels my love. My child is happy and healthy. I trust my intuition as a mother. When I ask for help, I receive help. I am proud of myself as a mother. I am patient and kind. I accept help from others with an open heart and mind. My body is beautiful, capable, and strong. I take care of myself so I can take care of others. My child is loved and thriving. I appreciate the experience of motherhood. And take a deep breath in and exhale completely. Wiggle your fingers and toes. And when you're ready, open your eyes and just notice how you feel. Thank you guys for sharing in that with me.
Thank you, Brenna. Thank you for those beautiful affirmations. Well, this has been such a beautiful time. I have learned so much from each of you, and we're just grateful to be able to share in this experience and to be able to send this out to the world and our networks. It's just been a big blessing to be able to hear your wisdom. So thank you all for being here, to all of our amazing panelists. Thank you all who were here in attendance, still hanging in there with us a little bit longer than we expected. But we so appreciate you. We hope to be in touch with you, and just so grateful for all of your partnership. Thank you all. We hope you have a beautiful evening. Take care.
Thank you for joining us. Bye-bye.
Good night.
Yay!